Hi, welcome back to Med Rounds. I'm Dr. Tim Moser. Today's discussion is stroke. Stroke is the third leading cause of death in the United States. Number 1 is heart attacks, number 2 is cancer of all causes, and number 3 is stroke. And stroke has remained the third leading cause of death in the United States for decades. Now, when you think of stroke, you think of older people. And strokes are much more common in the elderly population. And in fact, women have a tendency to have strokes a little bit more often than men. Now, part of that reason is because women live longer than men. And so if you're still alive in your 80s and 90s, you're more likely to be a woman. Therefore, you're more likely to have a stroke. Other risk factors for having a stroke include high blood pressure, high cholesterol, diabetes, and having heart problems such as atrial fibrillation. Now, younger people can also have strokes, but that is more often related to some type of medication being used. Prescription birth control pills, for instance, that contain estrogen, can raise a woman's risk of having a stroke. Those people who use illegal drugs, especially cocaine and methamphetamine, also are at a higher risk of stroke. So what causes a stroke? A stroke occurs when the blood flow to a portion of the brain is stopped. Now, when this happens, part of the brain is not getting enough blood, therefore not getting oxygen and food. So that portion of the brain, unless blood flow is restored, can be damaged or die. Symptoms of a person having a stroke can include slurred speech or difficulty speaking or understanding when somebody else speaks to them, numbness, changes in the vision, changes in your balance or hearing, change in taste, or change in sensation on the skin. Often these symptoms are localized or limited to one side of the body. Depending on the type of a stroke the person is having, pain may not be a symptom at all. At times, people don't have what we would describe as a full-blown stroke. They might have what's called a transient ischemic attack, or a TIA. This is commonly known as a mini-stroke. It can have the symptoms of numbness or weakness in a localized part of the body, but the symptoms resolve completely and you're back to normal, definitely within 1 to 3 hours. People that are having TIAs, though, should have a full medical evaluation, because this can be a warning of a larger stroke that is about to happen. Now, strokes can be divided into 2 broad categories. The first is what we call ischemic stroke, and this is where a blood vessel leading up to the brain or inside the brain gets plugged up or occluded. And when this happens, it blocks off blood flow beyond that point, damaging the brain. This can be from a thrombus or a blood clot that is broken off somewhere else in the body and traveled up to the brain, or it can be actually damage to one of the brain blood vessels, and as it splits open, a piece of plaque may break loose, flowing downstream and eventually plugging up the blood vessel. Ischemic stroke is by far the most common type of stroke, accounting for almost 80% of the strokes that people sustain. One major risk factor for having an ischemic type of stroke are in persons that have atrial fibrillation. In atrial fibrillation, a clot can actually form in the upper chambers of the heart. And when that clot breaks loose, as the blood is pumped out to the body, some of that blood, of course, goes to the brain. If the clot in the heart should happen to break loose, it may flow up to the brain and cause a blockage of an artery. To help prevent strokes associated with atrial fibrillation, patients are placed on blood thinners, such as Coumadin, otherwise known as the generic name warfarin, or a newer drug called Pradaxa. Now, if a person is having an ischemic stroke, they have about a 4-hour window to get prompt medical attention, and in many cases, drugs can be given through an IV to help dissolve the clot or open up the blockage in the blood vessel of your brain. This can help restore blood flow and save brain tissue from dying. People that get prompt treatment from an ischemic stroke have less of a chance of dying and have a better long-term outlook on retaining the functioning that they had previous to the stroke. Now, a second type of stroke is a hemorrhagic stroke. With a hemorrhagic stroke, one of the blood vessels in the brain is leaking blood. This can be from an aneurysm or a weakened blood vessel in the brain. As the blood leaks out of the blood vessel, it mixes with the fluid that normally surrounds the brain. Once blood leaves the circulatory system in the brain and mixes with that fluid surrounding the brain, it becomes very irritating to the brain. Often, people with a hemorrhagic stroke have a very severe headache from this irritation from the leaking blood. The blood vessels surrounding the brain are also irritated by this leaking blood, and they can go into a spasm and shut down, thus compromising blood flow to other parts of the brain. Those persons that have a significant hemorrhagic stroke may die 50% of the time, even with medical management. Now, a hemorrhagic stroke requires much more invasive medical treatment, oftentimes including surgery. If a blood vessel is leaking, sometimes the skull has to be opened and the leaking artery has to be surgically clipped to prevent it from leaking further. In some cases, patients that have sustained a hemorrhagic stroke can be treated by an interventional radiologist. Now, an interventional radiologist can slide a catheter through a peripheral vein up through your neck into the brain and help take care of the leaking blood vessel that way. Once a person has a stroke, rehabilitation is very, very important. Even though parts of the brain might be killed because of lack of blood flow, the brain can compromise with proper therapy. Lots of times people can regain some of the function that they have lost. The brain heals itself very slow, and so it's not going to be a rapid recovery. It may take months or even years to slowly regain some of that function that was lost. Reducing your risk of having a stroke is very important, and this usually involves keeping your blood pressure under good control, keeping your cholesterol where it should be. If you have diabetes, keeping your blood sugars in that normal range or as close to normal range as you can possibly get. In addition, regular exercise has been shown to reduce the incidence of stroke. This has been Dr. Tim Moser with MedRounds, wishing you the best in health and prosperity. Take care.